Hello and welcome to this edition of Eurofound's Ask the Expert webinar series. We're delighted to have you join us this afternoon in a very rainy deluge that we have here in Dublin. I hope you're joining us from better parts of weather in the rest of Europe and beyond. We have large numbers of you joining us here today and registered to participate in this event, and we're delighted to have you with us today. You're joining by live storm, and that will allow you to participate actively in the webinar as it continues throughout the next hour. And this particular edition of our Ask the Expert, we are joined by our colleagues from EU-OSHA, who Xabier Irastorza, you're very welcome to join us this afternoon. But it's a joint event that we're organising with our sister agency in Bilbao, the EU agency responsible for occupational safety and health across the European Union, and jointly, of course, with Eurofound, the European Foundation for the Improvement of Living and Working Conditions. And today we're going to be looking very much at navigating this new era of psychosocial risk in Europe. We've done a lot of work on working conditions, and we'll talk a little bit about that as we go through the next hour or so. But this particular focus is going to be on the psychosocial element of things. We know that the world of work has changed quite radically over the last 10 years or so. And most recently, we've seen lots of change in terms of the digital arena, but also there are other changes which have been brought to bear, which have seen profound digital and social transformation. We've seen new workplace hazards emerging, like, for example, greater heat issues at the workplace, and other psychological issues, physical issues, and environmental issues have come into play. But I suppose what we want to look at today is we know a lot about the physical risks, but when it comes to the psychological/psychosocial risks, is Europe, in fact, becoming a more stressful place to work? These are questions which will be answered, I hope, by our two guests and our experts who are brought to bear today. We'll be looking and delving into the results of two landmark surveys. One is the European Working Conditions Survey, and the other is EU-OSHA's 2024 European Survey of Enterprises on New and Emerging Risks, the ESENER survey. We're going to look at the mental health risks, we're going to look at the physical well-being and psychological well-being, and we're going to look at the risk factors which are prevalent. But we also hope to look a little bit at the potential solutions and look at how we can address some of the issues which are raised over the last period of time, and trying to create an environment at the workplace which is increasingly more supportive and a resource that responds to the quality of work that we're looking for. So without further ado, I would again introduce our speakers, Agnes from Eurofound, Agnes Parent-Thirion, who is an expert in this area and has been the guru of the European Working Conditions Survey for many, many years. And Xabier, thank you very much again for joining us from Bilbao. So you're very welcome. I would remind our guests and our participants that you can put your questions into the chat. We will be responding to them over the course of the next period of time. And of course, the experts are here to respond to your queries. It is an interactive event. So Agnes, to start us off, Eurofound has been working on the Working Conditions Survey for many, many years. We are probably the longest standing working conditions survey across the European Union. Perhaps you can go into the specific findings that we found in our most recent survey for the results from which were in 2024 on the psychosocial risks, and give us also just a brief outline of what those trends were and the remit of the survey.
Yeah, thank you, Mary. So yes, we started to run the European Working Conditions Survey in '91, and since then it has increased tremendously, both in terms of country coverage. We started at 12, now we are 35, but there are also working condition surveys outside in the world using European Working Conditions Survey. The latest one is Canada, but we also have Korea, we have US, China, Latin and Central America. So yes, and all these surveys like us, they've increased the questionnaire, the coverage to look at how work is changing. And one issue which has been at the forefront of working conditions research has been around psychosocial risks. So what do we see? Work is more fragmented, in terms of employment and places and time of work, and sometimes more fragmented, but you can also say more flexible, and that's, I think, is quite an important change. There is more service-oriented work, whether, in presence with workers or, mediated through technologies. There is a little bit less physical work, because of the change in activity, but work is also more skilled and uses more technology. We have a lovely curve of computer use since 91, and you really see how this has gone up. So these are some of the broad thread of what has changed in terms of working conditions.
And in terms of the working conditions also, I mean, we've seen these trends over the years. I mean, back to 1990 was the original survey, isn't that right? And we have been operating it more or less at 4 or 5 year intervals since then. And so we've seen the trends emerge. And one of those is, I suppose, that we've also seen in parallel that we've seen new jobs. There have been more jobs. So there are more jobs. There are more people at work in the European Union than there were previously. And we know that 2/3 of these jobs have gone to women, for example. And we also know that there's a large majority of these jobs are concentrated in services. Can you talk to me a little bit about how you've seen how those kind of changes are reflected in working conditions?
Yeah, I think the increase in women's participation has had a profound impact in the type of work that people were doing, what we are monitoring, and the issues we are looking at. From a gender perspective, women's work is more about working in services, in gender segregated occupations. It's put at the forefront the issue of reconciliation between work and care, because women remain the one that do most of the child rearing work. And from because women are, and there's also the issue of inequality, because women are not treated the same way as men, and so from a working conditions perspective, it means that we've had to look more at care and cure, because these are the type of work where you would see more women. So we've looked at issues around emotional demands much more. And then we realized that men as well were exposed to emotional demands. And then we've learned that, this kind of a more psychosocial dimension of work was also associated with physical work, and that the two interacted, to have an impact on, for example, musculoskeletal disorders. And we've seen also this issue of differently or unfairly treated coming at the forefront. So the inclusion of women in the workforce has had a profound effect on what we're looking at and how we are looking at it. And
And just very briefly on that, Agnes, because we can go into it later, but are women more affected by the psychosocial risks in the workplace than men on a more general basis?
It's a complicated question. So yes, on average, they're probably more affected, but it really depends on the type of work situation. And this is where a survey like the European Working Conditions Survey is very useful, because we can distinguish between across occupations, across industries, across whether or not you're working with clients, and look at the combinations of what we call risk, but also resources, and see, which is the cocktail that needs to be addressed at the level of work. But clearly, sadly, women are more exposed to violence at work, and they're more exposed to discrimination. So this, and they have less power. We have less women managers. There are more women who are afraid to ask for improvement in working conditions than men. So yeah, we have seen quite a lot of differences.
Okay, well, we'll maybe come back to that a little bit later also, but to give us a rounded picture of everything that we know in this area, Xabier, I would like to talk to you also about the EU-OSHA survey. And you look specifically at the new and emerging risks in this area when you look at the survey. Can you give us an idea of the survey and also perhaps your kind of top level findings?
Sure, Mary. Thanks very much for the question, and thanks for having us here today. It's a great event. The survey, I think it's interesting following Agnes' introduction. In our case, ESENER focuses on companies and workplaces. So as opposed to surveying workers, we just talk to companies. We have carried it out 4 times in cycles of 5 years, so very similar to the work conditions survey. We started out a bit later though, in 2009. So the following ways were in 2014, 19. A bit younger. Yeah, and the latest was in 2024. We've interviewed workplaces, over 4,000 in 30 European countries. And the question that we want is to shed light on how workplaces are managing health and safety at work on a daily basis. I mean, there's no right or wrong answers. We just want to know what they're doing. We cover all activity sectors and size classes. And I think interesting for our audience is that we can build trends because the questionnaire has been pretty much the same since 2014. So we've got 3 observation points. And as you said, Mary, we have a strong focus on new and emerging risks. And by this, we mean particularly psychosocial risks, violence, bullying and harassment, stress, but also digitalization and all risks and opportunities linked to digitalization. So this has been maybe 2 of the issues that we've covered at large in the last 2 waves of the survey, very much driven by the changes brought about by the pandemic. And how it impacted on the world of work. I think it's also important to point out that we offer national authorities the option to top up the sample sizes. So some countries have been using ESENER in a way as if it were a national survey, and I think you do the same with the work conditions survey. And then very interesting too for us is not just about the survey and the numbers. We try to make sense of all these data and have follow-up studies combining with other international and national sources, different research methodologies. Often we go back to respondents of the survey and interview them face-to-face. So that's a bit what we're looking into. And regarding findings, I think, that was your question. Sorry, I took a bit of the introduction. We've seen an increase in the reporting of psychosocial risks over the years, but also musculoskeletal disorders. I think it's something that Agnes mentioned in her introduction. And we see an increase in share of establishments, I would say, reporting the presence, but also being aware of it. And then at the same time, we've noticed a significant impact of digitalization in the way establishments work and how they link it to the management of health and safety and worker participation, which I think is something that...
That's something that I wanted to just ask you a little bit in terms of the transitions that are ongoing with greater digitalization and of course the green transition. Are you seeing the kind of psychosocial risks emerging from those changes as they kind of play out in the workplace?
From the point of view of the companies on the ESENER survey, for sure, we have seen some trends building up. We see an increase in the reporting of work intensity, information overloads, what we call blurring boundaries between work and private life. These differences, these findings differ by country though. And we have certain member states where you would see the reporting of working alone, for instance, being an issue that many companies are concerned about, or even the lack of ability to work with digital technology. So I think these would be the biggest issues emerging when it comes to psychosocial risks and digitalization. I have to say though, Mary, that we also see a vast majority of establishments not making that link between digitalization and risks at work. When we talk to them openly, only a third of our sample would make that link. So we think there is an awareness issue as to what potential impacts the use of digital technologies and the digital transition might have on the health and safety of workers. Yeah.
That's interesting, Xabier, because one of your other findings, I think, was that about a quarter of all companies surveyed said that they didn't see any psychosocial risks. Is there a kind of a cognitive dissonance going on here?
Yeah, that would actually be our feeling, and it's very difficult to confirm or to have the ultimate solid evidence to say that, okay, this is a huge statement from EU-OSHA. But our findings over the years suggest that we should be having an issue around awareness. As you said, a quarter of our sample tell us openly that they have none of the psychosocial risk factors that we asked them about. This share differs by activity sector. It is higher in agriculture and manufacturing, by country also, and it is particularly high amongst the micro and the small. So our feeling is that there might be an awareness issue, and I don't want to get too philosophical, but what is a risk factor? This question about what constitutes a risk factor, and I think there could be different cultural approaches to what represents a risk factor. We also have a question on time pressure being a risk factor, and the reporting differs massively by country. In some countries it's very high, and in others very low. We think awareness about what represents a risk factor,
which of course is part of the job of EU-OSHA, is to raise that awareness and provide that information resource.
Absolutely.
And yes, you wanted to come in there.
Yes, please, Mary, because I was struck as well by this finding of companies not reporting, psychosocial risk. And we have a finding in the European Working Conditions Survey, which is about information on psychosocial risk, which is also extremely important because we ask about information on OSH. And in general, it's only 10% of workers who say they don't have the information, and they're mostly new entrants, young workers, so there are issues, but there are issues that we used to deal. But there are 29% of workers who say they don't have information on psychosocial risk. So I think this shows how important it is that we raise awareness, because the first step in prevention is that people need to know what they are facing and what can they do.
Yeah, I mean, I suppose that is it. It's also the workers' impression of how much knowledge they have of these things. What is their general sense of understanding the risk that is at play there? I mean, one of the questions that come in here, it's slightly related to the digitalization aspect, and the risks there. Maria Carmen Pendea is asking, what is workers' general sense of well-being in relation to the rise of AI in work? Now, I know, Agnes, in the European Working Conditions Survey, for the first time, we've asked questions about the use of generative AI at the workplace. I mean, do you have a sense of what workers feel about their well-being in relation to the use of AI?
I didn't look at that particularly, but what we noticed is that the use of AI, it was already 11% of the workforce using AI. There's a lot of disparities between sectors, so it's mostly used, Gen AI is mostly used in financial services, but it's also quite used in transport. And I think it's quite important because these are sectors in which AI is used, maybe used in different way. But we also ask more generally about, what is the impact of technology regarding your task? And the interesting finding for us is that it's not really, the technology hasn't really it has deleted more tasks but it has rather created new tasks and created more interactions. So I think that shows that, as technology, come in, this is a topic which is changing the way we work and changing our relationship with people, and we need to look at this with far more attention than we have been.
In the next round of the survey. I mean, maybe something also, Xabier, just to come up slightly on what you were talking about, the general psychosocial risks. Elaine Murphy is asking, is there a hierarchy of psychosocial risks across Europe, and is there any consistency in how they are assessed?
I'm not so sure we could say there is a hierarchy, but we do see, for instance, that there might be an issue around risk assessment, and I think the question is very, very relevant. One of the issues that comes up from the survey, we have a share, again, around 24-25% of establishment, this seems to be the magic number, that tell us openly that they don't carry out any risk assessment. For us, this is a big issue of concern. There is a legal obligation in the EU to carry out a risk assessment, and I think it's quite telling and an issue of concern to have 1/4 of our sample. And this is actually quite a stable share that tell us openly, no, we don't carry out a risk assessment. We're very keen to know why that is the case. And they tell us either they don't have hazards or risks, or if they do, they know them. so they don't need to perform this. So this is something that again, it links to our previous intervention and your question, Mary, about awareness and as I said, an issue of concern. So this happens for all type of OSH issues, but also particularly for psychosocial risks. Yeah.
I mean, a question that comes in from Charles for me, which I know, Xabier, you're not going to be in a position to make a call on this particular question, but maybe you have something that you could contribute. It's, are psychosocial risks an integral part of job evaluation, and should it be remunerated?
Interesting. I think they should really be part of any assessments when it comes to risks. And that's for sure. But we see that it's not always the case. Far from that. We know that in some member states, it's actually very recognized. There are tools. And in the questionnaire in ESENER, we ask establishments whether they are missing any support when it comes to including psychosocial risk in the assessments. It doesn't really seem to be a huge issue among those that include social risk. The problem, again, of challenge, I would say, is this awareness of whether we want to include them or not. First place. Well, they're included. Establishments are not really telling us that is much of a problem when it comes to career and risk assessments. There are some difficulties, though, very clearly reported by establishments when it comes to managing psychosocial risks. And it's always very consistently the sensitivity around the issue, the difficulty to talk openly between colleagues, hierarchy about psychosocial risk. There's still a big challenge, and establishments are telling us very openly. Those that are very active in managing psychosocial risk, they tell us that that's the main challenge.
Yeah, I mean, I'd like to move on, if you're okay with, I'd like to move on to the issue of digitalization and looking a little bit there also perhaps at related issues to digitalization. And then, yes, one of the interesting factors that we've looked at here is the rise of AI and digitalization, telework at the workplace. The 2024 results show that there's increasing boundaries between work and life. More people working at home, more people maybe fudging the boundaries between when it's appropriate or, appropriate to work and not work, etc. From a job quality perspective, when you've been looking at this, are you seeing that this right to disconnect, is it an intrinsic component of job quality? Or in fact, are we going to be seeing that as a luxury that just applies to those people who can actually access it?
It's a very hard question to answer, but let me start, to try to advance into it. First of all, what is job quality? We are at Eurofound tripartite, and we've worked a lot with our tripartite stakeholders about this. So for us, job quality is measured at the level of the job, and it is made of these characteristics of work and employment that have a proven causal relationship on health or well-being. Either they support health or well-being, or they, impact it negatively. So from this perspective, the right to disconnect, we can associate it with issues around blurring frontiers. Is it, shift work? Because a lot of women we know, they do their work, they take care of their children, and they come back, to do 1 or 2 hours after, when the children are in bed. So then, that would be, something around a shift. Then the issue of recovery. So we know high workload, not good for your health. Working shift, can have a problem, if you have this kind of a split shift, not recovery, not taking a break, not a good idea. But we also, so I think the issue is about the regulation of telework and how do we do it? And that needs to take into account the individuals that work, the type of work that they perform, and the company that they are in, and their need for coordination. So strictly speaking, it is not a part of job quality, but this is something which can be used to support job quality. And there's another dimension which I think is quite important to consider. In some cases, it's nobody is asking the worker to work at midnight, but it can happen, And that is also why it's important, to discuss these issues, in your workplace with your workforce about what, is good, what is acceptable, what is not. So it's a whole.
It's always that balance, though, Agnes, isn't it, between what the worker believes to be appropriate for them and what is seen perhaps as being too demanding or an imposition on the personal life of the worker. So it's always trying to find that balance.
Yeah, and with the companies, I think it's very important that this issue of a proper telework, a sustainable telework in some way, is being discussed. You need to regulate, and you can decide which level of regulation you want to put, but it needs to be part of a whole idea of education, learning, exchanging, talking. And this is something which Xabier and we found quite worrying, that we've seen that the involvement of workers on, setting their objectives, on being involved in improvement in working conditions, it's been declining since, in the case of EWCS 2010, and in ESENER, a different date. But I think this is very important. When you have things that are changing, you need to involve the workers, because they're the one performing the work. And, the coordination, the control, the cooperation, is very important for the performance of companies. So the fact that we have this trend is quite worrying.
But maybe a little bit related to that, Xabier. I mean, we know from the EWCS results that physical sitting is one of, it is the primary physical kind of concern that we have now about the way that we work. That's very much linked also perhaps to the fact that people go home and sit, or they sit longer periods. Is that also then, that's a physical concern, a physical condition, but in fact, does it relate to the idea of more job, work intensity in terms of the psychosocial risks?
We think it does, Mary, actually. And we have an item on the questionnaire, which is prolonged sitting as such. Before the first 2 waves of the survey, we had it bundled with other items, but we decided to pull it out. And God, that was a good decision, because it's the #1 risk factor reported in Europe. So we're very, in a way, pleased to see that establishments are aware that prolonged sitting, it is a risk factor. But it's also a bit, I wouldn't say surprising, but maybe it was a confirmation of something that we anticipated. So it is very high up there as a concern for European workplaces, and not only in general, but also linked to the use of digital technology. So definitely we should shed some light on prolonged sitting. And regarding your question, indeed, findings would suggest that it seems to be associated with increased work intensity. When running statistics on our findings in ESENER, and I'm focusing on the latest wave, we do see a higher reporting of work intensity, time pressure, information overload among those establishments that report prolonged sitting as a risk factor. So a quick answer to your question would be yes. Yeah, to see it.
That link is interesting. And likewise, Agnes, just to bounce back to you then on the whole idea of job insecurity versus work insecurity. And I mean, it's a new thing that I learned in this survey about how work insecurity is the fear of how we work, as distinct from the job insecurity of losing your job, but that is increasingly growing, and that it's higher now than the job insecurity itself. So is that the rapid pace of digitalization? Is this causing more anxiety? Is this a fear factor that we should be considering into the future?
I don't know what are the reasons for that, but I think, yes, it is increasing, and 15% of workers, fear that they will lose something that they like in their job. And I think we do have digitalization, so some tasks are being automatized, or, the way the work processes is organized is coordinated in different way. So it is obviously impacted about what you do, what you like to do, and how you do it. But there are, all other factors which are important. And I think the big transition around climate change and decarbonization, this is also impacting on the way you do your work. We've had with the COVID, we've realized that our systems were very efficient, but they may not be that robust. So when something goes wrong, it creates a little bit of a chaos everywhere. And we have the demographic aging, and one, important phenomenon which is associated to it is labor shortages. So I think people see themselves that there are many things changing, around them, and this is impacting the way they work, their autonomy, the skills they use, the task, is their task used, can they do their work well, which everybody wants to do, it's impacting their relationship with their colleagues, with their customers, with their managers. So yes, there is probably some anxiety is too strong word, sorry. Concern about it. And yes, you would want, especially in a context where you feel your voice is, there are less possibilities for you to be heard. This is a worry.
Again, about these emerging risks, in fact, in the context of the new world of work that we are encountering. I mean, I want to bring in a few questions here from the audience. Question here from Krista Meister. Hello, Chris, how are you? Is there any psychosocial risk factor that only has a negative impact on workers' well-being satisfaction? What we observe is that the same factors are also associated with, inverted commas, good jobs, high flyer jobs, positive well-being outcomes. Do you want to take that one, Agnes?
Yeah, so I think it's a complicated question, but I'll try to simplify it. So psychosocial risks are about risk, and we define them as looking at the impact on health and well-being. So if you're exposed to job insecurity, work insecurity, all these things that we've been, discussing, this is a problem for them. At the same time, this is something which is quite important. If you have little autonomy, this is going to be a problem, especially if you have a huge workload. So there's also this idea that there are positive things, and if you don't have these positive things, you are also being at risk. But when we look at the impact of psychosocial risk, we realize, that there is a health impact for workers, but there is also this health impact as a cost for employers. And there was a recent study by ETUI on the basis of EWCS 2015, which showed that the financial impact of exposure to psychosocial risk was 100 billion euros per year. And there are, I think, if I remember correctly, 8% of death by cardiovascular disease, which could be avoided, and 23% of depression, which could be avoided, and 6,000 deaths or whatever. So I think it's very important to realize that this is also a loss of opportunities for companies, because when you have people out sick, you have to redistribute tasks, you cannot, things that were planned, you have to reschedule and whatever. So it is quite important for companies and workers as well that, solutions are found and that there are less exposure.
I mean, also, I want to bring you in, Xabier, on this question here, which I think is written for you. Do you think there's a problem with policies being written to tick the box on managing risk, but then with no framework for how individuals should follow the policy, it makes it tokenistic? Do you think that's an issue that we're dealing with?
I think that could happen, particularly in some contexts. It is an issue that we see, and that in a survey like ESENER, it comes very clearly when you get maybe some positive replies to some questions, but then you see, analyzing the rest of the answers, that it doesn't quite follow up. So you could see that maybe there is some kind of compliance at one level, but not really an organizational culture that is preventive when it comes to health and safety. At the same time, I have to bring to the attention all the very good examples that we have in the survey, like ESENER, that we further investigate in face-to-face interviews. And when we talk about all the concerns, and I was very clear about the issue and awareness, when it comes to psychosocial risk, we did a follow-up on micro and small establishments, and it was very inspiring to see some very small establishments having actually very inspiring leaders that really care, and that it proved to be very successful when it came, for instance, to manage all the challenges of COVID. So I think a survey like ESENER also helps us showcase how establishments are doing a great job in a topic like psychosocial risk, when there is really a very clear commitment that goes beyond what may be expected from them. So I wanted to bring that to attention today too.
So, I mean, good practice at play, and that is your experience. That was a question from Nikki Chalk. And there's another question from Frédéric Turlin. Bonjour, Frédéric. There are many studies on psychosocial risks, proof that there is a negative impact on workers' health, lots of initiatives taken by social partners on EU sectoral level to tackle this increase. But should the EU adopt new legal provisions in the framework as part of the Future Job Quality Act? Now, again, not your job to make that decision, but like, what would be your thoughts on that question?
Well, the first, if I can start, is this is a question the Commission has asked the social partners, and they're starting to provide their answers, and the views are divided. Now, if I look at it from what the data show me, the data show us that, yes, psychosocial risk has an impact on health, and it costs money. The data also show us that 29% of workers would like to get more information on this, on prevention of work-related stress, and the overall majority of the workforce say what is most important for them is a safe working environment for their physical and mental health. So that's what the workforce wants. Then how we get it, I think we are all working, towards trying to achieve this. But there is a strong concern from everybody, that health is so important. And this is also in our treaty.
Yeah. I mean, a kind of a follow-up to that, Xabier, in some ways, is a question from Ramuna Kobaite, which is, have you analysed how involved are employee representatives in the assessment process? Do they have sufficient competencies and resources, or are the risk assessments mostly carried out by service providers in isolation from these employee representatives?
Yeah, that's a very, very good question. Key question. Actually, we see a very diverse pattern of practices across countries. In some countries, there is more of a tendency to outsource the whole exercise of risk assessment. So, I mean, it's not right or wrong, but ideally, we feel, and we have examples from all the countries where even the smallest of the establishments would take care of these risk assessments. So, one of the issues that the colleague was raising, indeed, we see different practices when it comes to the involvement of employee representatives. And I want to touch upon what Agnes mentioned before. We see a concerning trend over the years since 2009 in our case, when we look at those establishments that are managing psychosocial risks and that have an active commitment to do so. There is a very worrying trend as the share of establishments that involve workers or worker reps in the management of psychosocial risk, it is decreasing, and it is clearly doing so. It's something that it comes, as I can be honest, a bit of a shock to us, because these are establishments that are acknowledging the presence of psychosocial risk. They have measures in place, oftentimes increasing shares of measures, and still at the same time, worker participation is decreasing. So I think it's something that is important to share with you today, and as an answer to this question. Something
to keep an eye on. I mean, I want to move on a little bit and just talk about, again, these emerging changing risks that we have seen over the last period of time. And we seem to have been heaving from crisis to crisis over the last number of years, but one of the crises clearly was the pandemic and the impact of COVID-19 on our lives, but also on the way that we work. And telework was an obvious offshoot from that. But also we had this interesting issue which emerged with relation to stress for those who are in sectors that are dealing directly with the public. Agnes, can you talk to us a little bit about how we've seen maybe an increase in burnout or stress-related factors for those sectors that have that engagement with the public, and perhaps since COVID-19?
Yeah, it's very interesting because you asked me this question in our preparatory meeting, and I had a look at the data. So my first hinge was, oh, let's look at the proportion of workers, in contact with angry clients. A little bit of an increase, but not much. Then I thought, oh, it's probably a recognition issue because during the pandemic we were all clapping. Yeah. And no, it's about the same. Then I thought, oh, what is it then? And I looked at job quality, and then I've seen that the 3 job quality had decreased for workers in health and education. Physical environment, work intensity, so they are exposed, to more high-speed work, more to tight deadlines, more to different people telling them you have to do this now. And, more emotional demands. But social environment also. Workers in health and education, they report more physical violence, more humiliating behavior, more, I'm looking at my list, more sexual harassment, more, all these kind of things. So I think we have to look at the conditions under which the work is being performed. And a key factor would have to do with the labor shortages that we've experienced. A lot of people after the COVID, they left the health sectors. We have a market where you can do, you have more opportunities at the moment. And when you have labor shortages, then, you have more disorganization in companies.
But again, here we're looking at health, particularly as a sector where there would be greater exposure in that area, education, areas where women are more present than men, generally speaking. I mean, are we again looking at this gender dimension coming into the spotlight? Is that really, the most significant issue that we're looking at here?
Well, I think, you have to look at the general trend and this big transition that we've been discussing: digitalization, climate change, decarbonization, demographic aging. And then you have to look at what's happening in certain sectors. And, health and education have had some of these issues around labor shortages. But of course, and this is something which we were quite surprised, there are so many differences in terms of job quality between men and women. And in some cases, women have lower job quality, on most of the job quality indicators except physical environment. So this is an important issue to consider and to address much more. And I'm hoping, I can say that the quality jobs and the new gender equality strategy that the Commission, will make the connection and will support
to address some of that. Yeah. I mean, we talk about the gender dimension, but of course there's also an age dimension. And one of the questions that came in just now, which has just gone off my screen, is from Jean-Michel Mouvson, who's from Perroche, and is saying that researchers show a substantial increase amongst young workers dropping out due to psychosocial risks. Is that something that you recognize? Maybe, Xabier, you can say something on that.
Yeah, on this, actually, we don't differentiate by age groups in ESENER, so we wouldn't have information directly coming from the survey that could shed light on this. We have, of course, concern around absenteeism linked to psychosocial risk, but in general, so we don't really have information when it comes to actual age groups in ESENER. ESENER is mostly about size and sector. Yeah.
That's interesting, actually, because that's an area I wanted to ask you about, was about absenteeism. I mean, Agnes referenced there the cost, the economic cost, of these psychosocial elements for the economy. But what I would also like to ask you about is presenteeism. So people actually turning up when they're sick and perhaps just being present, but not actually contributing. What have you found about that in terms of an issue?
Yeah, it is actually a big issue in the sense that it's difficult for us to measure it, to know what's the prevalence of presenteeism, right? I mean, people that work while sick, not only physically, but mentally. So there is a big challenge into knowing how many people are actually, or how many people we're talking about, right? I know there are surveys that ask the workers whether they've been working while ill, but we don't have ideally like statistics or a register knowing that. It's true that in EU-OSHA we've carried out several studies just trying to assess first the issues around presenteeism, and for us when it comes to linking it to the cost issue, it would be around the loss of productivity. That's what research seems to suggest, and we do have evidence that would put the cost of presenteeism actually at higher numbers than those of absenteeism. We've also tried to model it. I've actually looked into models of cost of bourrage and building on work done by researchers in Australia. We've tried and introduced presenteeism as an indirect cost in the modeling, and the shares that presenteeism would represent in total cost would differ depending on the country. But we're talking about sizable numbers. Again, I think the big challenge, Mary, answering your question, is knowing actually what's the size of presenteeism. It's very, very difficult to estimate it, but this would be the main issue, I think, linked to loss in productivity.
But we know, so therefore, but we do know that there is presenteeism, and possibly from what you're saying, rising, where we know there's absenteeism, we know there's an economic and a social cost for these psychosocial risks. We know that there's a health risk, clearly, which has its implications for the economy and our services industries, etc. But we must look at the solutions, because it can't all be bad. There must be ways that we can address that. You've referenced here the Job Quality Act. Clearly, there's a gender equality strategy. There are things underway. But when we talked earlier about information, Xabier, we know that from the EWCS data, there's 29% of workers say that they're not informed about stress prevention. How can we actually help a company move forward in this area? How can we ensure that the worker knows what information is available to them that can help them in this context?
Absolutely. I think that's one of the big challenges, right? And it links to, I think, several of my previous interventions today, and also Agnes's point. Awareness is a key factor. We need workplaces, we need employers to be aware that psychosocial risk factors are an issue. And I think that's the first step. One of my first intervention and your question, remember, we had 25% of workplaces that tell us openly. It's very difficult to change something when there is not an understanding and awareness that it is actually a risk factor. So I think that's the first step. We need to do maybe more events like this, campaigns, awareness raising activities, to just get to those that are not aware that it's a risk factor. When we look at those that are very active, we see, and I mentioned before, increasing shares of establishments, having procedures in place, having measures in place, and being aware also of the difficulties. But for me, I think the way forward is always bringing together workers and employers, ensuring that workers are involved. There is significant research and evidence showing that the worker participation when it comes to managing health and safety is essential. But when it comes to psychosocial risk, is even more important. So I think we shouldn't disregard that. I think it's a key way forward to work together with workers, ideally formal representation, but we know that in some very small establishments we have that direct participation is very good. And it links to my previous intervention on leaders, employers, business owners that are very, very aware and committed to the prevention of psychosocial risk, and they work hand in hand with workers. So I think from our point, we will want to make that a very strong point and suggestion.
And yes, you want to come in there?
Yeah, because I think, we converge on that, and when you look at the literature on, what makes a workplace intervention to address stress, successful, one of the first most important factors is management involvement. When management realize there is an issue and they decide to tackle it, in general, they manage to tackle it, but they don't tackle it alone. They tackle it with the workers, direct participation or employee representation, because workers, they are the one doing the work, that sounds, obvious, but So they have ideas on, what is the problem, what are possible solutions. And it's very important to work together for this. And it works better that way, that's for sure.
And Agnes, one of these possible options that workers could come to the table with is more training, maybe to offset workload, to offset work intensity, information access. Are there things that we're seeing in the EWCS that help us understand that better?
So training is a large issue. So you can train people into what are the psychosocial risks and how they can answer to them or address them. But it's also important to realize that in this world where so much is changing, training is essential for workers to learn new skills and use them. And in that context, this is by exercising your autonomy, trying to do your work, that you can regain some control. So we need to look at it in, the narrow sense of training, again, for better psychosocial environment, but also training as a resources for you to be able to bring in what you have to bring, and in a way that works better.
Yeah, I mean, the issue here of the younger worker, and particularly and the younger female worker, keeps returning to the table. And Frédéric is also coming back with a follow-up, which is that Nordic trade unions are very worried by the increasing number of young workers with academic degrees, specifically young women, that face burnout after 2 to 3 years of work. And he's asking, does your research find trends that are relevant to this issue?
So from a European Working Conditions Survey perspective, we've always found that the work of young workers was harder than that of older workers. And it's somehow explained by the fact that they can do more physically demanding task, and also their learning. It's your first steps in a career. You may not know exactly what you're good at, what you want to do. This is, you got this job, maybe it's not the final end, job. So you don't know the community in which you're working. So it is harder. It's true that at the moment we have also this gender divide. We have a lot of young women who are well educated, and more men who are more into physical occupations. So, and we are working in dispersed workplaces in the case of white collar. So I think there's many things happening around young workers issue. And we have a research project next year just about this.
Excellent. We'll come back to you on that, Agnes. And maybe a question, Xabier, just for you before we move into wrapping up here. From Lieve van Dijk is asking, have you studied what the impact of performance reviews is on motivation? Is there a link there with burnout? And I know that we've moved into a phase where assessment, evaluation, performance reviews is very much part of the workplace. Have you seen any emergence there of how that's linked to the psychosocial?
For sure, we have, and not directly with ESENER. We still haven't followed up in that, but we see an increase in share, and for sure you really can identify it and measure it depending on the sector. So we have, for the last 2 waves, questions on this, and while the overall reporting of this performance review is still not very high, we'll be talking about the share of establishments under 15%. I mean, don't quote me on this because I don't remember by heart, but it is true that it does have an impact on stress levels for sure. So that's what our preliminary findings would suggest, but we still haven't looked in depth into it for the 2024 wave. Yep.
But perhaps we can kind of wrap up with a positive démarche as well. And EU-OSHA is launching into its 2026-28 Healthy Workplaces campaign, which is very much a response and in fact part of this idea of making sure the information is clearly available to workers. and that they are aware of what constitutes these kind of risks. When you're embarking on this now, Xabier, what is EU-OSHA seeing in terms of where are the sectors, perhaps, or the occupations that they feel should be targeted to try and address the sort of issues that we've raised today?
Absolutely, Mary. Yeah, we're looking into how working conditions affect workers' mental health, right? And the campaign is our big effort to try and raise awareness. It is part of a wider context on the topic, the European Commission Comprehensive Approach to Mental Health, the European Strategic Framework on OSHA, and also development member states. The campaign will be running until the end of 2028. It's organized in different priority areas, but to answer your question, we have a specific focus on those sectors where either awareness may be low or where there is a big reporting of psychosocial risk. So this is a bit of a twofold approach. The answer to your question, we're looking into health and social care, transport, construction, agriculture. These are the education also. So I think these are the 5 big sectors where we're looking into it, and the priority areas that we're working on every 4 months, because the campaign is long. So we think it's good to have like a focus for 4 or 5 months. We'll start by psychosocial risk assessment and management. Then we'll move on to harassment, sexual harassment and violence. Then we'll be working into physical risk and mental health with a very specific focus on agriculture and construction. Then we'll have a specific area on psychosocial risk in the health and social care sector. We'll be finishing by the end of 28 on working with mental health problems. So that's in a nutshell the big lines of the campaign.
So a very complete and comprehensive program, which will go some way at least to addressing some of the issues that we have discussed today. And of course, I think we probably could talk about this for another hour at least, certainly from what I see in terms of the questions in the chat. One that comes in from Clara just at the end here, Lauren Sorano, is about prevention at the origin. So that talking about, why not look at job redesign, staffing, scheduling, leadership training, worker direct participation. And I think, Agnes, clearly, that is what your work is all about, is researching and looking at all of these elements that feed into the job quality aspect. And perhaps you want to give a quick outline of what we will be looking at into the next period.
Yeah. So Mary, what I like to say is, we're looking at job quality, and job quality looks at all these characteristics, including psychosocial risks that have a relationship and health. When we look at how job quality is distributed by type of job, we find 5 groups of job. There's one group, about 20%, everything is good or better than average. There's one group, 19%, everything is worse, less than average or the worst, so these are poor quality. And then we have 3 other groups. And there's one group where people, lack opportunities to grow, to develop, which, you can associate with, exposure to psychosocial risk. And for this group of workers, it shows how important it is that we offer them opportunity to do jobs which are more suited for their abilities. And, we can imagine that it should be good for the companies as well. And then we have 2 other groups, and they're kind of interesting also, because one is more physical, and people have these demands, but their experience of their working life is quite good. But the other groups, everything is good except work intensity, and they assess their working life as, quite poor. So it really shows that at this moment, the workforce is learning an awful lot. We can see our skills index going, really up. And this creates, a change in the balance. So you have to adapt. And it's very important that we support workers and companies in this process. So that's something more positive comes out of it, because there will be, the working age population is decreasing. So it's very important that there are more workers working better.
And for longer. Yes. So thank you, Agnes, for that wrap up. And clearly, all of the work that we've discussed today, there is ongoing research collaboration between EU-OSHA and Eurofound on everything to do with quality of work and also sustainable work into the future. These two surveys, ESENER and the EWCS, are both online. You'll see the links which are in the chat, and you'll be able to find them on EU-OSHA's website and on Eurofound's website. The results of the most recent working conditions survey are available with all of the data also online on our website. There's also a series of webinars and indeed podcasts which explore in greater detail different aspects, including job quality, but also the gender dimension and other related aspects. It has been an absolute pleasure to talk to Xabier today and Agnes on this issue. I hope we have you back for more. I'm sure we'll be able to follow up. Certainly the level of chat and engagement has shown that there's a huge interest in this, and perhaps actually as we see the Quality Jobs Roadmap stroke Act continue to evolve, we will come back to these and other subjects related to the world of work into the next phase. So thank you very much, both our speakers today, and thank you to our audience. And I hope you managed to glean some information from our event this afternoon. And you can find this on our website within, I think, the next 2 hours. It will be available to replay at your leisure. If you have any questions or any follow-up queries, please don't hesitate to contact either the two experts that you've seen me talk to this afternoon, or indeed anyone else within Eurofound or EU-OSHA who will be able to respond to your queries. That is what we are here for. So again, thank you both very much for joining me, and I wish you all a very good afternoon.
Thank you. Bye.
Thank you very much. Bye.